नमस्कार, मैं हूं अनूप जलोटा और आप मुझे देख रहे हैं न्यूज़ टुडे में।
World Polio Day. We are celebrating today. The Rotary is celebrating the Polio Day today as well, Polio Awareness Day. So we welcome you all. Dr. Dulal Ghosh, the eminent ENT surgeon. Dr. NVK Mohan, consultant otologist, ENT and cochlear implant surgeon. Dr. Arjun Das Gupta, consultant rhinologist, ENT and endoscopy skull-based surgery, CMRI. Dr. Chirojit Dotto, consultant laryngologist, ENT head and neck surgeon, CMRI. Dr. Anupama Satpathy, consultant otolaryngologist, ENT head and neck surgeon, CMRI, and other so many medical fraternities present here today. I could see, I could meet, I can talk to them. Our distinguished dignitaries of the dais, members of the chamber, friends from the media, ladies and gentlemen, good afternoon and a warm welcome to you all. On the occasion of the World Hearing Day being celebrated today, ladies and gentlemen, the theme of the conclave is exploring innovations in healthcare delivery. We are extremely fortunate and privileged to have with us this afternoon one and only Dr. Dulal Ghosh, the ex-Sheriff of Kolkata, a luminary in the field of ENT who needs no introduction at all. I have a long list of his profile that I'm not going to read, sorry, because the program will be over by that time. So thank you very much, sir, so much for your kindly accepting our invitation and to be chief guest of our conclave and sparing your valuable time. I know since morning he was with the Rotary doing a polio vaccinations day awareness, and he's such a good human being doing a lot of social activities, I can tell you. I also sincerely thank the eminent panel of doctors, Dr. NVK Mohan, Dr. Arjun Das Gupta, Dr. Chirojit Dotto, and Dr. Anupama Satpathy for taking time out for their busy schedule to address this August gathering. Today, digitalization, automation, and technological enablement are affecting industries in profound ways.
Happy in the sense, today is a great day, the hearing day. In this particular day, myself, I do not know earlier why I was called by Raju. Because Raju and me, for last 50 years, we are together with our friends. Because since the Calcutta hospital was born, since then, for the first house surgeon was by me. I was there, an ENT surgeon, ENT house surgeon there. And 1 year after, before that, in front of Calcutta Hospital, no medicine shop was there. And he is the person, first I was introduced, because in the Ekbalpur junction, his shop was started. Since then, the Dhanantari, the world famous now, you know very well, he has himself established in that way. So it is a great thing for his achievement. And I am very happy he called me to call you in front of you. Now the day you see the connectivity with this society, we are doctors. we have connections, no day. Every day we are connected with the people, with the society people. But very less time, we are not getting that number of people, connectivity with youth people. The people, creamy people, knowledgeable people, elite people, that is a great thing. That is a surprising for me. Why? It is such a thing that hearing impairment, hearing people's conditions, how they are having suffering, that are not so-called interested by the people like you. So I am very, very glad to see I am speaking in front of you. I am just telling one point. When I was a Sharif of Calcutta, at that time I was called in Taj, Bengal, in a luncheon meeting. And at the time there is an endemic area, chikungunya was the disease that was spread all out in India. So they requested that you have to speak a little bit about the chikungunya disease. But astonishingly I found all people are in front of mine, all are not only dignitaries like that, the high commissioners of whole Calcutta and around this eastern region. So they are in front of me, and I am the speaker. So that is one thing is very surprising for me, and today is another day surprising for me. I am not speaking with these people, the suffering people, but people like you. Now the cochlear implant that was already you have sold, the year 2000, I was the first person to go to USA, to Australia, and having trained there. And I am the first person, all my good friends are, and younger brother also. So that is the milestone we have been. Now what Mohan and this colleague are doing, and whole India is doing the same thing, cochlear implant. So this cochlear implant now is an achievement of the technology. By that, we assure that nobody in future, both old and young children who born with no hearing, they will hear normally. So that is the achievement we already achieved. So this is a great thing. Number 2 point, already discussed, noise pollution. I have the opportunity to work with Birla Mukherjee, Professor Birla Mukherjee. He is the person, he is the fighter for the deafness, for the noise-related deafness. And in every year, we are fighting how the noise is destroying our hearing. So now the environment itself and the hearing itself are going down, and the hearing impaired people as a whole in India are increasing due to these noise pollutions. So how this is now not only the fight of the ENT doctor, it is the fight for each and everybody, especially the people who are in front of mine. I request, because all are pioneer industrialists and other things, so give a hoarding, every company will give a hoarding, how we can combat this hearing loss, and how hearing and the deafness and sound, what is illness, that if one small things in all Calcutta and surrounding everywhere, if we can put to consciousness amongst our people, because we people cannot hammer each and everybody. It is our consciousness by which we can stop that things. That is very much required. So I request, this opportunity I am getting, so I am requesting, please do for us, so that our people, Indian people as a whole, will survive and will be a good hearing. Thank you very much once again for the good hearing.
May I request Sri Rajinder Khandelwal and Sri Somrutu Roy to kindly felicitate Dr. N.V.K. Mohan with an authorio and memento. May I request Sri Rajinder Khandelwal and Sri Somrutu Roy to kindly felicitate Dr. Arun Dasgupta with an authorio and memento. Thank you so much. Ladies and gentlemen, Dr. N.V.K. Mohan, consultant oncologist, otologist, ENT, and cochlear implant surgeon, CMRI, has over 25 years of experience in ENT practice. Previously, he worked as assistant professor ENT at Kamini Institute of Medical Science of Narketpally and SVS Medical College, Mahabub Nagar.
Life, it's no greater honor than being felicitated by our own beloved Dulalda. Dulalda obviously doesn't need any introduction, but we must say, for me, Arjun Chiro, donkey's name always comes first, so I mentioned myself first. But for us, Dulalda has been Dhritarashtra and Bhishma Pitama rolled into one. He's always given us extensive love and encouragement and has been the true elder brother and mentor for us. So to be honored by him, to be felicitated by him is truly a great honor. And thank you, Khandelwalji and Sureshji, Shom, and the rest of the team, and obviously my colleagues for this wonderful opportunity. And the honor to be addressing such an august audience full of dignitaries and the top who's who of the industrial world of Kolkata. So like Dulalda said, that today science has come to a stage where we can help children who are born deaf hear and hence speak. So we have the wherewithal, we have the technology. We can detect a child with hearing loss at day 1. But still, why is it that we need a World Hearing Day? The unfortunate thing is that hearing is one of the most neglected of the senses. I'll come to that in a while. A few figures. Worldwide, it has been seen that 80% of people with need for hearing care, 80% of this need is still unmet. And the cost of this deafness, the untreated deafness, to the world is $1 trillion. Now, how staggering is that? How staggering is that? And it's really unfortunate that we are probably ourselves to blame for this society.
If a child has born without smell, there's a limit to what we can do. But if a child is born without hearing, there is a lot we can do. So let's do it. And with your help, just spread the word that this is what you can do. This is preventable. We can do a lot about hearing. And third, most important thing is, Mohan already touched, again, we said there will be a lot of overlap, that everybody in our family, we know somebody who has dementia. And somebody or other asks us, what can we do to prevent dementia? Trust me, there is no magic drug. We have come back from England and we know of a fantastic medicine. You take a pill and your dementia stops. It's not going to happen. There is 2 things you can do to prevent dementia if you think that you have started to forget or your dementia is approaching. Number 1, pick up a new hobby, something like dancing or cooking or something you haven't done before. Number 2, if you have a hearing loss, get a hearing aid. These tools are known to slow down dementia or prevent dementia. This has been proven. There is no A about it.
Just one point I want to add. The first cochlear implant surgery in Eastern India is done to an old man. He has 3 times MP.
Right.
3 times MP in Midnapur. He was first person in Calcutta. It was operated there. So you think of it. It is not the age. To each and everybody.
So what stage
Everybody who is not hearing, both ear. It is not one ear. Both ear with a permissible not hearing, to that people, it is an indication.
At what stage it should be taken? Decibel,
Sir,
the hearing
the simple
testing
rule
is done.
So simple rule is,
Yes.
as long as hearing aids can work, the person wears hearing aids. If hearing aids are of no more benefit, then that person needs cochlear implantation.
Okay.
Simple.
Young lady, you have something to ask? Yeah.
Yeah. Good afternoon. A very good afternoon to the panel. This is Rachna Nahata. Sir, I fragmented it into 4 parts. First is, what is the role of a tinnitus in your ear? Tinnitus, the sound. Second is, what is the impact of the steroid? If the terrapin, something you say that injection dete hain, agar kaan mein suddenly loss hoti hai. Third, ek earbud agar hum dalte hain kaan mein, if we give an earbud to the ears, is it harmful? And the fourth is, how do you use a mobile phone? How effectively can you use a mobile phone to stop hearing loss?
Tinnitus and hearing loss go hand in hand quite often, Lots of patients with hearing loss will also have tinnitus. What is tinnitus? Tinnitus is, a person starts perceiving a sound which is not there. So this is generated somewhere along the pathway from the ear right up to the brain. So this can be a bothersome thing for some people who do not have a hearing loss, they've just tinnitus. It can be very bothersome. There are other different treatments for that. You can do tinnitus retraining therapy, meditation, and calming yourself. One weird thing about tinnitus is the more you think about it, it's been proven that physiologically it increases. The more you think about it, the worse it gets. There are, some parts of the brain end up having more blood supply, and that causes worsening.
The lucid comments of our speakers have enlightened us, and the views and insights have enriched all of us. We appreciate that the medical technology is rapidly progressing in the field of ENT and is also undergoing change. We are grateful for all our speakers for sharing their valuable thoughts to us. I thank CK Birla Hospital, CMRI, for associating with MCCI for this event. I convey our sincere thanks to all those present in today's session, our media friends, for the presence at this event. I do hope the deliberations of these sessions will be duly carried by the media. With these few words, I propose a warm and a hearty vote of thanks and request all to carry it with an acclamation.
इस दिन का खास उद्देश्य है कि हम समाज को हियरिंग लॉस या डेफनेस या फिर श्रवण शक्ति की समस्या को लेके समाज में हम जागरूकता उठाएं। मैं आपसे इतना ही कहना चाहूँगा कि बधिरता बहुत ही दुखद एक प्रॉब्लम है और इसे हम हमेशा नज़रअंदाज करते आए हैं या इसे हम इतना अहमियत देते नहीं हैं जो हमें देना चाहिए। बधिरता से छोटे बच्चों को अगर नवजात शिशु को अगर बधिरता है तो वो बोल भी नहीं पाते और वो क्लास 4 या 5 से ज़्यादा कुछ सीख नहीं पाते और बुज़ुर्गों को जो उम्र के हिसाब से कम सुनना चालू करते हैं तो उन्हें धीरे धीरे इससे इरिटेशन, डिमेंशिया, डिप्रेशन ये सारी प्रॉब्लम्स होती हैं। तो छोटा सा यंत्र इन सब का समाधान है। आज मेडिकल साइंस यहाँ इस मुकाम पे पहुँच गया है कि हम एक नवजात शिशु को भी हम जो सुनता नहीं है उसे हम सुना सकते हैं। तो प्लीज़ समाज में जागरूकता उठाएं, बढ़ाएं और इस समस्या को नज़रअंदाज ना करें और किसी बधिर आदमी के बारे में कोई कटु बात ना कहें और उनका मजाक नहीं उठाएं। हमेशा इन्हें एनकरेज करें कि वो भी सुने, वो भी ज़िंदगी का आनंद लें और एक स्वस्थ जीवन यापन करें। नमस्कार, मैं डॉक्टर NVK Mohan from Kolkata, CMRI Hospital.
On hearing acuity and hearing related problem as such in what is the scenario. क्या होता है जो सिनेरियो का ज़रूरत होता है, जो सुनाई ऐसा चीज़ है जो हम लोग का वी वांट दैट आवर हियरिंग इज़ आवर डिमांड. हियरिंग सुनना चाहिए. दिस इज़ उसके लिए हम लोग लड़ाई करता है. अभी जो चलता है बंगाल और इन इंडिया में, हम लोग ज़्यादा ज़ोर से बात करता है, ज़्यादा ज़ोर से हॉर्न लगाता है, ज़्यादा ज़ोर से हम लोग का जो इंडस्ट्री होता है इसमें आवाज़ बहुत होता है. इसको लिए हम लोग का कान का सुनाई बहुत कमती हो जाता है. Another very important factor is this mobile phone is now so rampantly used. ये अच्छा नहीं है, बिकॉज देखिए सब कुछ टेक्नोलॉजी बड़ा होता है, टेक्नोलॉजी आता है हम लोग का अच्छा करने का लिए, सुनाई का लिए, बट दैट टेक्नोलॉजी वी आर यूजिंग in Indian population especially, जो our populations are 70% are using this like of thing. ये think of it. इतना आवाज़ करता है, इतना ज़ोर से सुनता है जो दुनिया लोग सुन लाता है. तो ये भी अच्छा नहीं है. तो हम लोग का चाहिए जी अवेयरनेस. हम लोग ये गवर्नमेंट करके कुछ नहीं होगा, ये हम लोग आपका ही हिम्मत से करने होगा. हम लोग अच्छा से सामान्य होगा, जो हम लोग जोर से आवाज़ नहीं करेगा. जोर बिकॉज सुनाई इतना अच्छा है, कान भगवान दिया है सुनाई के लिए, इसको हम लोग खराब नहीं करें. तो ये हम लोग निजे सोचना नहीं चाहिए. तो कैसा होगा हम लोग का.